I am live. I am live to talk about a subject that used to be very much criticized. I don't know that it is much anymore. I think it all depends on who you surround yourself with. Breast augmentation. Now, before I get started, I want to disclose that I am not a psychiatrist, a psychologist. I am not a plastic surgeon. I am not anyone that has any medical background. And therefore, anything expressed in this video is simply based on my experience or my own personal research. So I urge you, anyone considering breast augmentation, please do the footwork, research your surgeon, research the procedure, make sure you identify exactly what it is you're looking for, what you're trying to attain, and how you're going to attain it, and by whom you're going to attain it, and be sure that they are credible, that they have a history of good work, successful surgeries, and just do the research. It's very important. Don't go get blindsided by a good deal somewhere, please. Granted, there are places that do great deals and have excellent surgeons. I happened to get one of those. I happened to come across a great deal, and my surgeon was an excellent surgeon. That being said, and any and all information in this video is simply for it's POV, I guess, my point of view, my personal experience with breast augmentation. I do have before and after photos. I don't know if it's acceptable to show them. I don't know. I don't know. It doesn't bother me because they're just breasts. I mean, men run around and show their breasts all day just because there's more tissue involved in ours. I don't understand. And they're sexually stimulating for men. Well, guess what? Men, your faces, your bodies, everything about you are sexually stimulating to me. So knock it off. You need to cover yourself with garb from head to toe. It's making a point. Anyways, my experience with breast augmentation. I had my breasts done in 2009, December of 2009. I went to a surgeon in Temecula. I keep saying Murrieta when I'm referencing, and it's not Murrieta. I get all the freaking cities in California confused. I'm not from there. I don't know anything about the place, but they have a lot of cities that sound the same to me or somehow resemble each other. And because I do have a disorder that sometimes alters my brain activity in certain ways, I do get them confused rather easily. So Temecula, not Murrieta, two completely different places. Temecula body contouring is what they're called now, I believe. Excellent stuff. I loved the ladies, the nurses that were there. They were wonderful to me. They were so informative and knowledgeable about the subject. I originally went in just wanting to go up from an A to maybe a full B or a C. And once I got in there and got to getting into the nitty gritty, I ended up going from a 34A to a 34D. And I don't regret it. They sound much larger than they really are, but that's because they are proportionate to the rest of my body. I've always been a little bit thick and bottom heavy. I mean, not bottom heavy, but just, I guess, going by the, what do you call it? Ethnic stereotype. I'm a white girl with thick thighs and a big behind. It's just not ethnically usually how it goes, I guess. I'm not ethnically stereotypical. Anyhow, that being said, you want to research your doctor. You want to research them well. But before you start doing that, this is my one request to these two women that go out there and get their breasts done. The reason I had my breasts done was because I myself felt very masculine. I felt very masculine. I wasn't being urged by anyone to get them done. I wasn't being urged by the desire, the need to go to get someone's approval or to get someone to like me or love me or for any other reason except that I felt masculine because of my breast size, and because I'm stocky and muscular. So even more made me look and feel like a man. And because I wanted to wear different clothes. Like a lot of girls could wear clothes, and to me, I just looked like I was. Let's just say a couple times men have actually asked me if I was transgender. Yeah. And one of those times was like actually after we had already done the do. So I was like, if I were a man, like, you already screwed me. So if I were, how would you react? Like, seriously, I'm not. I am a woman. I have 5 children. I've had 5 children, not naturally, but I did carry them all, gave birth to them all. I am a female. I was born a woman. I am a woman now. And just because I didn't have very much breast tissue and I was very muscular and stocky, yeah. He's like, lift up your head. And I was gullible, asked me, like, he goes, I just had to make sure. And I was like, make sure what? Really? Really? There's no Adam's apple, okay? Fucking jerk. Sorry for the words of profanity, if it's profane. I don't think so. Oh, I guess that was abusive, wasn't it? Fucking jerk. Okay. Sorry. Take that back. Anywho. So, yes. In 2009, I was so graciously gifted the gift of femininity and self-confidence and a whole new me. And I'm so grateful to the person that bought my breasts. So I went to Dr. Sarosi at Temecula Body Contouring. And like I said, he has a wonderful staff. You go in for a consultation. He discusses with you whether pretty much your reasons why. And he'll decide if you're a good candidate or not. I did review his website. I did review his reviews. I did do a little bit of research, probably not as much as I should have done. And that's not to say anything bad about him. Don't confuse me saying I didn't do enough research. I just know that there could have been a chance that I could have went in the wrong direction because I really didn't thoroughly research as well as I should have. But I was lucky enough to get a good surgeon. I was lucky enough to find someone that he did an excellent job. Now, that being said, you go in for the consult. He decides if you're a good candidate. There were a couple reviews in his reviews, but I think they were just haters trying to steer people in a different direction because they were saying he had poor bedside manner and things like that. And he was always very appropriate, always very respectful, always very understanding of everything I was asking and expressing. So, like, I think he was an amazing doctor. Very upbeat and happy. He wasn't creepy and fondling me all over the place and everything. I mean, he was doing his job like surgeons do, but it was never anything that was uncomfortable or creepy or gross or poor bedside manner. He does not use, I guess most surgeons use where they like completely knock you out. You have to have a tube down your throat, your eyes taped shut. And I guess that's a different kind of anesthesia than like if you go in to have, if you just have your back teeth or like your wisdom teeth, if you only have one set of teeth removed, they won't put you to sleep. But if you have to have oral surgery or multiple teeth removed, they'll knock you out. And I believe that's the method he used. For anesthesia, you're sleeping, but you're not actually under anesthesia to the point where your body needs like life support. I guess do I have that right? Because you do have to have a tube down your throat and all this other stuff for most of them. And it's not as invasive as others. Now he did. Hold on, let me not get ahead of myself. All it was gas. Count backwards from 10. Imagine you're on a wonderful island somewhere with a cabana boy, bring you drinks, blah, blah, blah. You start counting back from 10. You get to like 8 and it's over. Next thing you know, you're waking up. They're helping you sit up. They're helping you get to a recliner. That's all the surgery part. We'll move forward to. Oh, we'll get to that in a minute. Okay, so thoroughly do the research. First, sit down and figure out why the F you're doing this. If you are doing it because you want to please your man, if you're doing it because you want to be attractive to someone else, if you're doing it for any other reason but you're going to end up doing it and you will probably have regrets later. Because throughout the whole process, and this is very important, throughout the whole process, you have to keep in mind what you are wanting from this, not what anyone else wants from it. Because then you're going to go in, oh, too small, too late, too big, too late, too high profile, too late. I mean, you can go back and correct these things, but it's very expensive. My surgery cost $4,700. A very good price, And I have saline solution. I have saline implants. I don't have silicone. They're saline. The difference between saline and silicone is that, well, now silicone is pretty much it sticks to itself. It's very, it congeals to itself, I guess. So if you do puncture your implant, with pressure, it can come out, but it will congeal back to itself, so it doesn't like seep into your body anymore. So that's different. But silicone is much more expensive. Silicone is much more expensive because it does feel more natural. It does hold a different shape. You can still detect that it's not a natural breast, natural breast tissue, but it can appear and can feel more natural than saline. Saline solution when you bend over. Saline implants when you bend over. When I first had mine and I still had swelling, when I first got mine done, I still had swelling. Sometimes when I would bend over, you could see ripples in my breast. It wasn't anything that bothered me. I think there's a short time I tried to start dancing again after I had my implants done, and it's just not for me because I'm not. Oh crap! My battery's dying. Because I'm not like that kind of. I can't do lap dances anymore. I'm like so not a lap dance person. Hold on, my battery's dying. So yeah, that's the only time it would have even been anything inconvenient or if I had a guy that really was a shitty guy. Hold on. Sorry to show everyone my breakfast pants. Needless to say, it was just something purely cosmetic. Like the whole purpose of my breasts was not for me to expose them and show them to everyone, and something like that wasn't an issue with me. And I felt safer with the saline solution, so that's why I did that. And it was a much cheaper route. Let's see. So yeah, the person that bought them for me was at the time my better half, my spouse, my boyfriend, whatever. I'll leave that at that. That's all anyone really needs to know. He genuinely cared about me. He genuinely wanted me to get them for myself. It wasn't anything he cared about. Like either which way, he wasn't concerned. He didn't have problems with the fact that my breasts were so small. It didn't bother him. It was nothing he actually ever really thought about or noticed until he noticed my own attitude and behavior towards myself because of them. So, and things that I had expressed to him. Needless to say, that being said, he was so gracious as to get them for me. My little bud. Yeah, and I will be forever grateful because my confidence level is completely different. As a matter of fact, there's a lot that he did for me, psychologically speaking. We did have a lot of rough times, and the person that I'm speaking of is far from perfect. But there are some great things that came from our relationship, although it didn't last, and there were some horrible things that came from our relationship. There are also some great things that came from our relationship. He did teach me to stand up for myself to a certain degree. There was one point in time when I stood up to him, and he was like, "What the?" And I was like, "You're the one that taught me to stand up for myself." He's like, "Don't do that again. Don't do that to me." And I was like, doesn't make sense. But that was just one time, and yeah, we got through that. But anyways, we all have our moments. But he did actually help me gain my self-confidence. He did actually teach me not to let anyone run my life or run me over. He did teach me that I needed to get out there and get what I could on my own, because there wasn't always going to be somebody there to take care of me. And granted, I do receive benefits now, but I do only rely on myself. I don't allow myself to rely on anyone else, not even him anymore. And so, because I do have to hand him that much, he was always there when I needed him. For the most part, there were some times when he made it like so ridiculously stressful, and it was until right while I was about to lose everything, and then he'd follow through, or he'd pull through, and he'd be like, "Oh, here we go." Not his fault. I should be grateful for his kindness, but okay, sometimes it was a little bit unnecessary to stress me out that badly. And then he would say, "Well, then why didn't you just get out there and get it yourself? Had you done it and been responsible like you're supposed to, you wouldn't have this problem." But that was before anyone realized I had issues getting certain things done because of the situation with other mother flippers in the picture that were there against our objection. Back to the breast augmentation. Yes, make sure you're doing it for the right reasons. You want to make sure that you are mentally and emotionally sound. You want to make sure that it's not anything you're doing because you're feeling rejected by someone. You want to make sure that it's not anything that you're doing because you feel like you need to be something for someone or appear a certain way for someone. Do not do it for someone else. Do not let other people tell you, "Oh, you're doing it just because you have a low self-esteem," and that's the wrong reason to do it. Your self-esteem is your self-esteem. And I am an honest believer that if you choose to dye your hair, if you choose to get your eyebrows tattooed, if you choose to get your breasts augmented, if you choose to get a tummy tuck, and you're willing and educated about the risks, you're willing to take the risks and you're educated about that, and that's something that will boost your confidence, go for it. Don't let anyone tell you that self-esteem is not a good reason to do it. This is when self-esteem becomes a problem. If your self-esteem is low, not because of your own personal... Okay, low self-esteem generally comes from people who are abused. Okay, but there's also a certain level of your self-esteem that just comes from you and your criticism of yourself, your judgment, your idea of who you want to be or who you should, or who you think you should be. Now, for the longest time, my self-esteem was shit because I looked like what I thought everyone else wanted me to look like. And okay, yeah, it was okay with me. I looked fine, but there was always something that I didn't like about myself. Like now, I shaved my head, and once I shaved my head, it was a blessing in disguise, because I've always wanted dreads. I've always wanted this hairstyle. And never did I actually do it until I shaved off all my hair, and I had to quickly come up with an idea to fix what I had destroyed, because I loved my hair. I loved my hair, and I shaved all of it off because of criticism and judgment from other people, and because of lies being spread. I tried to make myself ugly because there were women insisting that I was screwing their husbands. There were people, and I was like, okay, well, if I'm just ugly, if I just make myself ugly, maybe they'll leave me alone, because maybe they'll believe that I'm not screwing anybody they think I am. Like, really. And it's the stupidest reason in the world. But anyways, when it comes to your self-esteem and your confidence, if you can identify and be sure, please, before you go get a breast augmentation, talk to your medical health professionals, and talk to, if you have to, a mental health professional. Not a mental health like county mental health. Don't do that, because you might set yourself up for a lifetime of destruction. But a real certified professional, or not certified, licensed professional, private mental health person, psychologist or psychiatrist, just to determine if you are mentally sound enough to make that decision. It is a permanent decision. And it's very important that you get what you want, and that you're sure you know what you want before you jump into it. Please. If it's going to boost your confidence, go for it. It made a world of difference for me. It did, however, have one negative result, which is obvious. Men are men, and some of them are just heathens, and all they see is breasts, and they're like, hello, how are you? And they no longer look up here. I actually took one of my white t-shirts and I drew a pair of eyes on it. And I was just like, my friend was like, what's that about? And I was like, well, at least they'll be looking me in the eyes when they're talking to me now. And that was the only regret that I had, was that sometimes people don't look me in the face anymore. And they're literally like, okay, whatever. Anyhow, yeah, the numbers, it did a world of difference for my confidence. Unfortunately, after I had them done, I was being abused, and I was in a really bad, controlling and abusive situation by the flipping unmentionable that had my child for me and repeatedly violated our rights. But that being set to the side, my doctor was amazing. I went for the consult. He helped me to identify why I was a good candidate, helped me to identify why I wanted them done, why I felt that it was something I needed to do, and if it was something I still wanted to do. He explained the risks to me. He explained how his operations or surgeries were different than others. He explained the risks. He explained how things were going to go. He explained what I was going to have to do pre-op and post-op. And then I still had doctor's appointments for, I believe, a year or 2 years after the surgery. So that being said, the first appointment you go to when you set up a consultation, that's your opportunity to observe the doctor and his mannerisms and how thorough he is. Is he just sitting there letting you ask questions, or is he offering information? Is he picking your brain as much as you're picking his? Because that's actually part of his job, is to make sure that you are a good candidate, not just physically, but also mentally, and not by doing like a mental assessment, but to make sure that you're doing it for the right reasons, and to understand what it is you're looking for, what you want, so that you get the results that you're out to get. Like I said, I went in with an A, wanting maybe a full B or a C, and I came out with much more than that. But I'm glad I did it. I don't regret that at all. Don't regret it at all. Needless to say, after the first consult, I decided, yes, that's what I wanted to do. It's the way I wanted to go. He was who I wanted to go with. I saw a lot of before and after pictures. I decided to go with the saline solution implants. I don't know if it's saline solution implants or just saline implants. I went with the saline implants. Mid-profile. They have mid-profile. They have low-profile that are more flat and round. Mid-profile, which are more flat, and they're still round, but they're not as flat. And then they have high profile. Now the high profile are the ones that you see that they always look pushed up. And it's all personal preference. Like, you decide what look you're going for. I went with the mid profile because when I don't have a bra on, it does look more natural. And when I do wear a push-up bra, if I wear a push-up bra, or when I wear a regular bra, it doesn't look as obvious. I don't have like a cute little munchkin butt up on my chest. I can achieve cleavage, but it's not as obvious and buxom as high profile would have been, which is what I wanted. Silicone, I believe, holds its shape better. You don't have problems with rippling in the bag, and you don't. It's just a different feel. Like, it's more natural. It's not as, I guess mine feel like water balloon-ish, because you have to maintain you have to fill the implant to a certain level of tension, if you understand what I'm saying, so that it doesn't look all ripply and gross. Like, you have to have it full. So it's like, they're not hard. Like a lot of people say, oh my God, you get your breast done, they're hard. They'll be hard like rocks. Your nipples will always be hard. Two problems I don't have, but I did follow every single direction that the doctor gave me. So I went with the mid-profile. I think, I can't remember exactly how much he filled them with. For some reason, 180 is like sticking out in my mind, but I think it was more than that. Anyways, because I was also involved in someone else getting their augmentation, so I might be remembering their facts. Anyways, so yeah, after I decided on what I wanted, that was it for the first appointment. The second appointment, I came back. It was just a review of everything we discussed on the first appointment, and he had the bra that they would send me home in, but they had implants that obviously were not implanted in anyone, both saline and silicone, so I could test them all out and see what would achieve the look I wanted and how big I wanted to go. So he said to wear comfortable clothes that I was used to wearing, and something that I could determine which implants and what size I wanted. So that was the second visit. It was pretty much just a visit where I sat and stuffed my bra the whole visit and looked in the mirror, checked out the side, checked out the back, checked out the front to make sure that was going to achieve what the look that I was going for. And that's when I decided, because everything I was getting for like a full B or C, to me, it really wasn't seeming like that much of a difference. And like, I didn't want like a huge difference so people would go, oh, wow. I wanted me to feel feminine, and I wanted it to match my body. Like, I'm short. So although I'm not like thick and super overly healthy, like at 125, the body mass index, whatever thing at the doctor's says I'm overweight at 125. Because I'm only 5'1", which is ridiculous because that's fairly thin. That's like all muscle. Maybe that's, I don't know. Anyway, now I'm 141. I'm 141 pounds and 5'1". So the breasts I got were in proportion with where I carry my weight. When I do get weight, it's mostly on my behind and my thighs, and a little bit in my midsection. But it's proportionate to the size of the breasts I got. So when I do get too thin, they are obviously a bit aplenty for my stature, I guess. But that's only when I'm like ridiculously fit, which hasn't been for a while, unfortunately. And even then, it doesn't bother me. I still love it. Anywho, so that was the second visit when I determined what size I would go. And then on the third visit is when you discuss exactly what's going to happen, because the surgery was done in a different location. The body contouring office was pretty much just for hair laser treatment and eyebrows, waxing, stuff like that. There were injections for lips and Botox and all that stuff is what the contouring office was for. And so he had the actual surgical center in San Diego where we would go for the surgery. So he had to explain where I would be going, what I needed to do before my operation, what I needed to bring with me, what I needed to not bring with me, what I needed to that I needed to have someone drive me there and drive me home. Obviously, because after surgery, you can't drive yourself home. Trust me. Now, it is painful. It is very painful. Once you get up from the operating table, you're pretty much going to be oblivious to everything. Okay, hold on. Let me get when you get there. When you get to the surgery center, to the operating room, you'll get there. He gives you a drug test and a pregnancy test all in one. For two reasons: if you're pregnant, surgery is not going to go forward. If you're on drugs, surgery is not going to go forward. Drugs can affect how your blood circulation. How anesthesia affects you. Drugs can affect a lot of things. So, especially when it comes to surgery and your blood pressure and your blood circulation and your blood, all kinds of things, your brain's tolerance, your pain tolerance, your resistance to anesthesia, your resistance to things afterwards. Drugs are bad for anyone that's going to have surgery. So drug test and pregnancy test. After that, he'll give you a robe, a hairnet. You have to make sure all the makeup is washed off your face. I had to go to surgery with no eyebrows. I think I barely penciled in a tiny little bit just because I was bad, very bad. Leaves room for bacteria to enter the surgical site. Needless to say, you have to have something comfortable to put on afterwards, something that you can pull together and either button or zip, not anything you have to pull over your head, because it's going to be difficult to lift your arms. They prep you for surgery. They had a hairnet on you. They lay you down on the table. They put in a partition. You can't see anything below you. If by chance you are at one point in any way, shape, or form conscious enough to see. My doctor and I chose nipple incisions. There are people that go through your belly button. There are people that go from your armpit. There are some that go underneath, right underneath the crease of your breasts. Mine is right around the bottom half of the nipple is where he did my incisions. And then he inserts the empty implants and filled them inside of my chest. I do have pictures. I think I'm going to go ahead and show the pictures. I don't know. This is just warning. If you're under 18, please do not watch. There will be breasts being shown. I'm about to show breasts like right now. Not my breasts, but pictures of my breasts before and after. Just so everyone's aware. And find my underwear when I got. Maybe if I can find them. Just have them. Okay. Oops. Okay. Warning, if you're under 18, please turn off this picture, this video, this live stream, or get an adult. And if you're under 18, I'm not sure why you're watching this breast augmentation live stream to begin with. Anyhow, your parents should be supervising you better. Okay, I'm going to show before and afters. And there's actually one that's like during the surgery, okay? So, let's see. Hold on, let me type this just to cover my ass. Warning. Hey. Oh, there it goes. This live stream, what would I say? Warning, this live stream contains
NUDITY.
Photos with exposed breasts / partial, is it partial nudity? Nudity. Parental supervision required. No under 18. Okay, now this is for the sole purpose of educational and informational. You can go on to Dr. Rosie's website and see just as many breasts, if not more. Obviously more. So I don't think I'm doing anything wrong. I think I will be okay. If YouTube has a problem with it, they will let me know, I'm sure. Okay, so here's my before. This is me. And as you can see, this is why I felt so masculine. This was during the surgery, while I was still on the operating table. And this is the after. Okay, there's the before and the after. Now, I don't know if the camera is good enough, but you can see the incision from here to here and from here to here. And that, I healed very well. I healed excellent. There's like barely any, hi kiddo. There's like barely any visible scar unless you are you in your chonies?
No.
Yes, she is.
Yeah.
I saw you walk past in your chones. Can you try to not do that? Because I don't want to get in trouble for that either. Even though
I have a party to go to today.
She has a party at 1. Okay, well, chonies don't expose any more than bathing suits do. I don't know. I guess people
Plus, it's just like a bathing suit. So
would like to impose their thoughts and ideas on us. Can you just go brush your hair and your teeth? Needless to say, I'm doing a live video. Honey. I healed very well. Scars are barely visible, and only when you look up close. I did everything the doctor asked me to do. After surgery, for probably the first half hour, it's maybe you're kind of oblivious to everything. You're just kind of coming out of it all. And they sit you in a recliner where you can sit up. You're all wrapped up. They put a sports bra on you. They put an ace bandage around you. Everything's nice and tight and comfortable. And then you come to and you wake up, and then slowly but surely within the next hour, you will start to feel it. You'll feel a lot of pressure on your chest, and you will feel a lot of pain. It'll be very difficult. You won't be able to lift up your arms. You won't be able to use your arms to get in a vehicle. If you have to get in a vehicle, I was in my friend took me in her minivan, I think.
I'm assuming they had to pick you up.
She went with me. She took me to the surgery, and she waited until I was finished, and then she drove me home. So I could lie down in the back of the van, but every bump she hit on the way home, I felt it. It was torture. It was torture. I'm not going to lie to you. For the first week, extremely painful. They give you pain meds, and trust me, you take every single one of them. It wasn't until about after the first 3 days, I could kind of get up and move around, and I wasn't asleep all the time. But for the first 3 days, I had to set my alarm to get up. Generally my pain would wake me up, and I would be ready for pain meds before I could take them. But I would have to eat and all that other stuff. And the person who got them for me was there to take care of me and help me through it. And it was pretty bad. But you have to do exercises. They call them exercises, they're massages that you have to perform on yourself to maintain the pocket that's inside you have to do basically this. And right after them placing them in your chest, it's pretty uncomfortable. But you have to do it. You have to do it, or they won't maintain. They'll get scar tissue. They can get scar tissue, get deformed, turn into big hard lumps of breast tissue on your chest, and you will be very upset, and it's very hard to and very expensive to correct. So listen to your doctor's instructions. He will send you home with a sheet of massages to do to yourself. He will tell you how to take care of the sutures on your incision. If your incision's underneath, I don't know how that goes. From what I hear, that is much different, a much larger incision, and more things can go wrong. One of mine did start. I do generally heal differently on this side than I do on this side. I don't know why. Let's see. On this one, you can see there was this spot right here that didn't come together. I mean, it started to separate. And I don't know if it was just because of the bindings or if it was, I don't know, movement or whatever. But that's the biggest part of my scar. And you can still barely see that. It's barely visible, but it's nothing that's embarrassing or disfiguring or. Yeah, so that was after surgery. A lot of pain meds, a lot of painful exercises you have to do. You can't take a shower for a certain number of days because you do have an incision until he sees the incision and removes the sutures if he has to. I think they came out themselves. I think the sutures came out themselves, if I'm not mistaken. But I could be wrong. Anyway, yeah, so probably within the first week, you're able to get up and move around and do normal things like take a shower. But pain, there's going to be pain for at least the first month. There's going to be pain for at least a month. The majority of the pain is the first week to the first 2 weeks. And then it just becomes like a pressure, a dull pressure, but it's still kind of a pain. You won't sleep on your back. I didn't even hit send. Reconnecting? Are we reconnecting? Okay, reconnecting. Sorry. I kept saying you won't sleep on your back. You'll only be able to sleep on your back. I know up until a couple of years ago, and I've had my 2009, up until a couple of years ago, I could not even sleep on my stomach. But that's because the pressure is such a weird pressure. When you lay down, it's like they're going to shoot out my armpits. Like, I know they're not, logically speaking, they can't, but in the back of my head, I'm just like, that's what it feels like. It's just an awkward pressure, and it's like not cool. So I can't sleep on my stomach unless I have a pillow underneath or a pillow above, mostly underneath, I think. But either way, that's irrelevant. So yeah, okay. Be sure you follow your doctor's instructions. Seriously, it's a very important step, and very very vital to your. Sorry, I just haven't moved. Anyway, very important to your breast implants recovery, your breast implants recovery, your recovery, and you getting the results you want. Now, there will be swelling for up to a year afterwards. You can be swollen for up to a year. I know I was swollen. My breasts look huge. They looked ridiculously huge. I went to see my family for Christmas, and yeah. I don't want to judge anyone by their reaction, but I see. Anyway, yeah, I don't care. Criticize me. They're on my chest. I'm the one that has to wear them. I love them. Needless to say, they were huge. They were huge for probably about 6 months. Probably about 6 months, they were huge, much bigger than they are now, and that was because of the swelling. I would say probably, yeah. Whew. They stayed about 3/4. Okay, there's like when you first get them done where they're swollen. I guess in here they really don't look that huge, but they were huge in this picture. Like super swollen. And then, yeah. Now they're not so swollen on the sides, and they don't look as huge. I guess they just felt huge because it was a difference. I wonder if that's really the case. Maybe they just felt like they were huge. Needless to say, you have swelling for like up to a year to up to 2 years after you have them done. You will have pain for at least a month, at least, and severe pain for at least the first week. Yeah, you won't be able to lift your arms. You won't be able to pick things up. You will be bound with a sports bra and binding. But all in all, my experience, afterwards, I did have a few appointments with my doctor. I had to have him look at the sutures. I had to have him see the progress. He had to make sure that I was doing the massages I was supposed to be doing. He had to make sure that I was still healthy and not having any problems rejecting the implants. Just like any other foreign body put into you or your body, you can reject them. So he was attentive to all those things. I had, I believe, 4 appointments afterwards. Maybe more, 4 to 6 appointments. I don't even know for sure how many appointments. It might have been just for the first year or for the first 2 years. I can't recall correctly. It's been almost 10 years. So, but I do know the first appointment was like 2 weeks after, a week after, and then once a month after, and then once 6 months after, and then I think once a year after. I think that's how it went. But he just had to keep an eye on my healing and make sure that I was progressing like it was supposed to. There wasn't any problems with me accepting the implants or my body accepting the implants, and everything went well. I loved it. To me, it was well worth the pain. It was only a minor setback for about a week. After a week, I'm one of those people that gets up, and even after cesarean sections, I had 5 cesareans, and I was like up moving around when I wasn't supposed to be. But that's because I'm stubborn and I can't sit still. But I was up and moving around, not doing anything I wasn't supposed to, but I was definitely doing whatever. They wouldn't even let me put it on the chat. So yeah, if anyone tries to get me in trouble for exposing breasts on my YouTube channel does say, just like all my others, social media, warning, this channel does contain adult content. Anyone under the age of 18, please do not view any of my videos or posts without adult consent and supervision. Although they are not pornographic in nature and they are not inappropriate, they do contain partial nudity or discussion of sensitive subjects like child abuse, rape, and other adult content. So that being said, that was my experience with my breast augmentation. I am very satisfied with the results overall. I'm very satisfied with Dr. Sarosi. I never had any problems with him. He was always very, very nice, very thorough, very, very, very good doctor. And his nursing staff was amazing as well. And I paid $4,700, which was a good price, to be quite frank. I believe his experience all comes from, I think, the Naval Hospital. He used to work for the Naval Hospital. He has a lot of experience with that. Yeah. Medical centers and surgical centers. A lot of good results, a lot of before and after pictures on his website. Yes, showing that he does know what he's doing. He does know that when you have breast implants, there are other things to take into account, not just the fact that they want to get breast implants. There are sometimes other issues that they have to address at the same time. And he demonstrates through his before and afters that he does address all those issues, and he does thoroughly consult and evaluate each patient according to their own personal needs and wants, and therefore he gets the results that they're expecting and that he's expecting. And I think he's an excellent surgeon. So once again, that was Dr. Sarosi from Temecula Body Contouring. I love the guy. Thank you. He's fabulous. He gave me a lot of the confidence I have now. Actually, he helped. He was a big part of it. Yeah. I used to not have a very good self-esteem at all. I did not feel feminine. I did not feel like anything I would want to be with if I was a man. And so once I got over that, now I love myself. I love my body. I only have issues with my nose, but that's because my nose has not always been this way. Like, my nose is a result of one of two things, or the combination of two things, brain injury and actual physical trauma to my face. So yeah, that's the only thing I don't like on myself anymore, but that's because it hasn't always been this way. And it does make me look completely different depending on which side you stand on. Like, literally, I look like a completely different person because my nose goes, ugh. And if you compare pictures of me when I was younger, I have pictures of me when, oh great, do I still have those pictures? Pictures of my first wedding. And my face is so perfectly symmetrical. I'm adorable little me, not to be conceited, but yeah. And then I look at myself now, my nose is much broader and much more to the right. It's still looking over there, and I'm looking over at you. So that's my experience with breast augmentations. I think we should all be happy and satisfied with ourselves and love ourselves no matter what. If it's not something you can afford, if it's not something you are fortunate enough to partake in, please don't let that take away from your confidence. Because from my experience, most men could give a rat's ass how big your breasts are. They might make a big deal about it. They might make a big deal about it. And yes, you might get bullied and made fun of if you have small breasts, like part of the itty bitty titty committee. And yeah, I know all about all that. Yeah. But you got to try to make sure that that doesn't affect you and who you are and how you feel about yourself. And understand that if you start to try to meet the standards and expectations of other people, that's when it becomes a problem. So like I said, I did mine for me and solely for me. It wasn't for the attraction or attention of any person. It wasn't so that I could go make more money being a stripper, because I wasn't even a stripper anymore. It wasn't so that I could, good morning, baby.
Good morning.
It wasn't so that I could gain the affection or love of someone else, or because they wanted me to do it. It was solely because I wanted to do it, because I wanted to feel feminine. I really truly felt like a boy, and I didn't want to. I didn't feel right in my body. And since then, I've had no problems. I have no regrets. I love them. They're fabulous. Every one of us is different, so don't let anyone criticize you if you do decide to do this. But please make sure that you do understand all of the risks. There are risks, major risks, just like with anything else surgical. There are major risks. Be sure you do your research. Be sure you find a great surgeon. Be sure he has proof, statistics, pictures, evidence that he has had successful procedures. Oh, God. And make sure that he fully understands what you want and what you want your results to be. Be sure to voice your opinion. I am one that has problems voicing my opinion. Like when I get my nails done, when I used to get my nails done, I don't anymore because I honestly believe that's where I got herpes on my finger from. More TMI. Anyways, please try not to be so loud. Okay. Still be respectful of everyone else's time and space. Yeah, when I used to get my nails done, like they would do something not the way I liked it. And I would just be like, okay. And I'd have to sit there and tell myself, well, you're paying for this. Say something. You're paying for this. And I still couldn't get myself to say anything. So I made sure when I went and talked to Dr. Sorosi, when I had my consults, and when I talked to the nurses made it even more comfortable because they were all there rooting for me, and they were all sitting there encouraging me to, okay, make sure is this what you like? Is this what you like? I don't know. What do you think? What do you think? It's your decision. You have to make it. You voice what you want. Don't be afraid or embarrassed to say, no, I don't know. I don't know how I feel about this. Don't be embarrassed to say, hey, this bothers me or this scares me, or I have a concern about this. Make sure you voice everything. Make sure you make your wants, needs, desires, what you're expecting, and the results you are going for are very clearly defined, and follow every single order that the doctor gives you post-op and pre-op. Every single. It's very important that you follow the doctor's orders. I cannot stress this enough because people go out there and have a major operation like this, and then they're like, oh, well, I don't want to do that. I'm like, I can't, I'm not going to do that because then I want to. No, you can't. He's telling you to do it for a reason. So please. A little itchy. Follow the doctor's orders. Okay, I've gone on and on and on for almost an hour now. I think that's plenty about breasts and breast implants.
Movies.
They're not for everyone. You have to decide for yourself. Be sure that you are not in a position that's compromising your emotional and mental health when you do make a decision like this. It is very important. I was fortunate enough to be in the beginning of all these shenanigans with my child here, and so I was not yet as affected mentally or emotionally as I was further on down the line, but
What?
Nothing. The whole shenanigans with Jeff. I got my breast implants like right when that was all beginning, and so I wasn't as affected emotionally or mentally. I mean, I was, but I was still strong enough at that point. I hadn't been beaten into the ground yet, thank God. Because I probably might have made different decisions regarding my breast implants, and that could have all gone wrong into the south, and I could have ended up at a freaking Dr. Frankenstein somewhere. All kinds of shit could happen. Anyway, please make sure you are doing it for the right reasons, and your reasons, only yours. Only yours. Do it for you. You're beautiful. You're fabulous. You're worth it.
You don't need a man.
Whether you get them or not. Natural. People tell me all the time, oh, your boobs are fake. They're not fake. They're really here. They're just not natural. They're really here. They're not fake boobs. They're just not natural. And they're mine. And I don't care what anyone says.
Even if it's me joking.
If you don't like fake boobs, then don't look at them or touch them. It's really not a requirement. It's not like a law that says you have to like Amber's breasts. I love everyone no matter what they do to their body. This is a body modification. These are body modifications. This is a body modification. These are pencil underneath our tattoos. Come on. This is the body modification. Why is one any different than the other? Just because one's surgical and one's not. This is a chemical change and technically a hair surgery. Yes, this is technically hair surgery. They are extensions. They're like hair implants. They're just semi-permanent because I can remove them. So semi-permanent, is it what they would be?
Yeah.
I'm not so sure that's what they would be. Anyways. Okay, yeah. So any modification you're doing to yourself is your business. Don't let anybody judge you for it. Don't let them make you feel stupid. Don't let them make you feel like, oh, you're fake. Bullshit. Bullshit. If people can dye their hair, if people can color on their, you know what? Just like the filters, I hear shit about that all the time. Oh my gosh, she doesn't even look like that. That's a filter. Are you kidding me? The filter is no different than the makeup you slap on your face every morning. Except the filter isn't gonna filter. Except the filter isn't gonna clog your pores. The makeup will. Can, might. Depends on which makeup you're using, I guess. Needless to say, let's all stop being so judgmental and critical of each other. And everything you do, make sure you do it for yourself. Do it for your own self-confidence. It's okay to have a low self-esteem and make a decision like that. I think if you have like a severe disorder, like body dysmorphic disorder or something like that, it's not going to help. That's why you need to make sure you are mentally and emotionally sound enough to make a decision when it comes to something surgical and permanent. You really need to make sure you are mentally and emotionally sound, because if there is an underlying issue like a disorder, nothing you do to yourself is going to change that. Nothing you do to yourself is going to change that, except for mental and emotional medical attention. So yeah, self-care, things like that. But I am not anti-surgery. I am not anti-modification. I am not anti-anything as long as you are sound enough to make that decision and you make it for you, not to impress anyone, not for any other reason but yourself. I'm happy I did it. I'm a very confident woman now. Yeah. Even when I take my hair extensions off, I'm like less confident. Because I don't look the way I want to look. It's not like I don't look the way anyone wants me to look. Really.
If you hear me making random noises
There's
in the background, ignore me. It's probably me falling on my butt.
Okay. There's like nobody on the planet that requested or said, hey, Amber, you would look awesome this way. No.
Whoa.
I used to. Is that my tea?
Yeah. I almost dropped it.
I used to get like suggestions or, oh, yeah, you would look nice if your hair was whatever. Or I would go to people and say, hey, what do you think if I did this to my hair and blah, blah, blah. I don't do that anymore. I don't do that. I just do what I want. I do what I want, and I'm so much more free. I'm so much more happy, and I love the way I look, because I'm not like looking at myself like everyone says they like this, and they're like, okay, and I did this because of someone's suggestion, or I did this because that's not what this is, and I don't care what anybody thinks about it, because I know I'm friggin' badass. No, when my hair is all short and shaved, I don't like it, because that was a result of me being mentally and emotionally abused. And so it was ugly to me. It was like a reminder every day of what people were putting me through and not even giving a crap about. So now I don't care who likes it. I don't care who loves it. I don't care who hates it, because it's me. I wear it in a bun, my shaved sides. I'll wear it down. I love it.
So wear it in a ponytail?
I do all kinds of shit to my hair.
Yep.
It's a mohawk. It's like in a mohawk all the way back. I don't know if anyone's seen the back really close up. Oh. I don't even know if it's like straight or crooked or what, but I had to do it myself because my lovely assistant here wasn't able to help me at the moment. But she wasn't willing anyway. Okay. But I love it. I love it. I love it. The only thing I don't love about it is that I have to glue them in, and the glue agitates my scalp. I want a new way to put them in, and eventually I would like it to be like more my natural hair. But because my hair is so fine, that's probably going to be literally impossible without looking ridiculously sparse and awkward. It's going to look like I have a bunch of little nickels just sticking out of my head. So I'll either have to keep doing these and just braiding them in, even when my hair does get long, which will be cool too, because then I can do like this girl, I think it's Kerosene. She's one of the most adorable little girls. So sorry. She's one of the most adorable young ladies I've ever seen. And she always has her hair in dreads. She does a lot of punk styles in dreads. She has these crimson ones that are like white to crimson, which was my inspiration to do this to begin with. God, I want these dreads. They're wool dreads. They're like $100. for how many I need. I can't afford it to save my life. These were $20. $7 for six something for each bag. And I needed 3. And they had 12 in each one. So, but these didn't come like this. Anyways, from breast augmentation to friggin' dreadlocks.
Amazing.
Yes. But I love who I am, and I don't care. Like my piercings, I have a job interview on Wednesday, and I am concerned. But it's only because I'm so used to being judged. Like, I'm worried that I'm going to get there, and they're just going to be like, who is this freak of nature? Like, are you serious? But I haven't been in the workforce or the work field for like 10 years. So I know things have changed. And I know it's more accepted because they have to accept it. Like, it's no different than my ears being pierced. And like I said in one of my other videos, that if it doesn't interfere with health or safety, there's really no way they have any right to control that or to discriminate. So this isn't any different than having hair. It's just not my hair. I'm not going to be around anything flammable or any open fire. Not that my hair is any more flammable than regular hair. I think this is flame retardant synthetic hair. Anywho, and these aren't any different than having my ears pierced or stretched. So I'm crossing my fingers. I in the back of my mind, I have a lot of anxiety because I have been judged based on my appearance a lot. And I just hope that people are able to be human and not bad human, but decent humans, and accept and understand people for who they are and how they express themselves. And I'm me, and I'm beautiful, and I love the way I look. And this is what makes me confident and ready to face the world every day. So if I have to change anything about me just to be appropriate for work, it's going to take from my confidence. It's going to take from my ability to be myself and perform to my best, the best of my ability. You know what I mean? So that being said, I think I've done an hour and 2 minutes. I got to go. Thanks for watching. I hope I didn't ramble on too much. I hope my pictures were not offensive. They're just breasts, folks. Nothing pornographic, nothing explicit, just boobs, before and afters. Not anything you can't see on Dr. Sorosi's website. And you don't even have to click on there saying you don't have to click on any of those saying you're an adult. They're just freaking boobs. No different than men's. See? Look, I can prove it. No different than men's. just what a man looks like. Why is it okay for them to not wear a shirt, but it's not okay for me to not wear a shirt? Before I had my breast done. It doesn't make sense to me. It's discrimination. Anyways, thank you for watching. I hope I was able to shed some light on the subject of breast augmentation and whether it is or isn't for you. I hope I only contributed in the means, or by way of education and enlightenment. Please don't use my video as the sole source of your decision making when it comes to such a surgical and invasive procedure. A permanent and invasive procedure. Do not use my video as the sole decision maker on whether you decide to get a breast augmentation or not. Please do the research for yourself. Love yourself and your body enough that you do it safely and smartly. Is smartly a word?
I don't think it is.
That you do it safely and intelligently. Is smartly a word? Where's my phone? I'm going to have to ask Siri. Anyways. Thank you for watching. Everybody have a lovely day. Do your research and remember, your life is at risk. It is a very risky procedure. I mean, with any surgical procedure. Let me take that back. Very risky. That makes it sound super dangerous. There are risks involved. Be sure you accurately assess the risks and accurately express what the results are that you are looking for, and thoroughly research your surgeon. And follow every single directive that he gives you, pre-op and post-op. Thank you for watching. Have a lovely day. End stream. End.